Good afternoon, everyone. I'm Mike Adelberg, and I have the distinct pleasure of hosting the third in a series of 3 webinars on the process for establishing and maintaining an impactful Enrollee Advisory Committee for DSNPs, a new CMS requirement that begins on January 1st of next year. This is this particular webinar follows up on our prior 2, and we will get a little more operational in this one, and we'll talk about the value add opportunities from running a successful, mature, and fully effective EAC. Next slide, please. The webinar series, as a reminder, is a partnership between Predict Health, Rex Wallace Consulting, supported by Faegre Drinker, with myself and Casey Dugan from Faegre participating in support of this great team. And you'll see the distinguished faculty for today's webinar on this slide. As a reminder, we encourage questions for the webinar at any time. Just chat them in. We'll take questions at the end. In the event we get more questions than we're able to handle during the webinar, we'll reach out to you one-on-one afterward. So please do chat your questions throughout. We'll make sure that we get to all of them. Next slide, please. And again, just a reminder, this is the third in a series of 3. In the first webinar, we talked about the new regulatory requirements and some of the background with EACs coming out of the Medicaid program and in MMPs. In the second one, we looked at successful practices. And again, the climax of the 3 is today. And with that, I am going to move us on to the meat of the presentation. Next slide, please. And I'm going to introduce my colleague, Casey Dugan.
Great. Hi, everyone. Thanks, Mike. So I'm just going to give a little bit of a refresher on the federal requirements. As most of you are likely aware by now, especially if you've tuned into our prior webinars, effective January 1, each Medicare Advantage organization that offers a DSNP will need to establish 1 or more Enrollee Advisory Committees in each state that they operate in. This requirement was finalized in the calendar year 2023 final Medicare Advantage and Part D rule. And in the rule, CMS sets broad federal minimum requirements and parameters for the EACs. But as we've noted at our prior webinars, they were fairly non-prescriptive and have left many details up to the DSNP. For example, details around meeting frequency, EAC organizational structures and procedures, and more. And although they were clear that states have the ability to impose more prescriptive requirements through their state Medicaid agency contracts with DSNPs if they choose, they really have left numerous details up to the DSNPs themselves in line with their prior experience in other programs. Next slide, please. EACs, they have not been previously required in Medicare Advantage at the federal level at least, but they're not new. They have been required in several other programs, including Medicare Medicaid plans that are operated under the Financial Alignment Initiative, Program for All-Inclusive Care for the Elderly, or PACE, Medicaid managed care plans that cover long-term services and supports, or MLTSS plans. They need to have similar enrollee advisory committees. And then state Medicaid programs need to have medical advisory committees, also known as MACs. EACs on similar councils may also be required at the state level, for example, in a DSNPs contract with the state Medicaid agency, or the DSNP or MA plans or Medicaid managed care plans, even if they're not required to set them up, they might be doing it voluntarily, and we know that several have done that voluntarily. Next slide, please. So the new requirement is one of several changes in the final rule that CMS enacted in order to improve experiences for dually eligible beneficiaries. This was a clearly set out goal when they wrote up that rule. According to CMS, through the experiences from EACs and other programs that I mentioned, particularly in the MMPs and PACE, has been very positive and successful. And in including this requirement for DSNPs, CMS noted that managed care plans derive significant value from engaging enrollees in defining, designing, and participating in and assessing their care systems. So this new requirement is designed with those experiences in mind, and the idea that extending them to DSNPs would produce similar results. Next slide, please. The good part about the fact that other programs have long used similar enrollee councils is that we've been able to gather a wealth of information, not only on how these programs operate and what the best practices are and what some of the opportunities are, but we also just know all of the benefits that they can provide. So we know that EACs offer DSNPs a new channel to receive rich and ongoing member input on critical plan issues. They can be used strategically to improve member experience, plan performance, and achieve outcomes. And if done in line with best practices that we've talked about at our last webinar, that support meaningful gathering of feedback and engagement, they can produce far more powerful insights than other methods of capturing member voice. For example, surveys, because they're just more interactive, they involve ongoing engagement, and they present opportunities for feedback loops so that people who are participating in the committees have the chance to see how their input is actually used by the plan. Leading organizations have already done quite a bit of thinking and innovating on how they're setting up, managing, and using EACs. And there really are a lot of different opportunities for getting the most out of an EAC and how to create the most impact with the feedback that you're getting. We've listed those on this slide, and I know that Shub and Rex and Jeff are going to talk even more about that. So I'm going to turn it over for the next slide.
Thanks, Casey. So just to ground us a little further on the requirement itself, right? So just to recap here, it's effective January 2023. So doesn't necessarily mean the first meeting has to happen on January 2023, but all of the guidelines, all the practices have to be put into place, right? The structure has to be there as soon as 2023 starts. And again, it requires, DSNPs to, I think the really important part here is that we have to include enrollees in plan governance. That's really the objective of CMS. That's even the title of the requirement down below, right? Enrollee input on DSNP operations. These enrollee advisory committees are just the vehicle by which we're doing that. They are a requirement, but the objective, again, is to include enrollees in plan governance, and we have to do it in every state in which we operate. So that's the gist of the rule. And there's a lot we can do, in the green boxes around here, or a lot of questions that we have as we approach this and build this, right? Everything from, what are the best practices from the other programs in PACE and LTSS and other programs, Medicaid, where we've done these similar meetings, and how to best involve members in plan governance. But there's a host of those. And this is a heavy lift, as you can imagine, which we'll describe much more, in the coming slides. But, CMS in the final rule actually says in the blue box that, this will cost, in their estimation, each plan on average, $1 million. And we only say that that's straight from the final rule. That's their actual, number, but it just speaks to how big this is and how involved this is. And, you have to do it in every state. You have to do multiple meetings in every state, potentially sometimes, and you may want to do them in different markets in each state if you have dense populations. So it's a big lift, and there's a lot to it, but a lot of questions at the same time, right? Lots of ambiguity, which are also addressed in these green boxes, where CMS is not being overly prescriptive. And this is a requirement, but in our opinion, this needs to be positioned as an opportunity, right? And we recently surveyed a lot of STARS leaders around the country on a separate topic, right? But one of the things that came out of those findings was that how you message a program to an organization, really determines how impactful it's going to be and how the organization embraces it. And I think if you position this as just a requirement from CMS, that's going to induce the organization to just meet the guidelines, and you might have a hard time getting more than that done. This presents a huge opportunity, and I think that needs to be mentioned in the case study when you're trying to get funding for this, trying to build it internally or outsource it, whatever whatever you end up doing. But the opportunity is huge, and that needs to be stressed. This, and Casey touched on this a bit, but this creates a new channel for member input. Right now, so much of our voice of the member feedback comes from surveys with which we just ask a simple question and get a response, and that's it. There might be a drill down question below it, but it's not necessarily dependent upon their answer. It doesn't necessarily drill down and become dynamic. Same thing with a customer service call recording, or if we're mining through our grievance data or complaint data. Those are not interactive. Those don't allow us to have an interactive conversation and really understand more deeply what that member is saying. This does. When we're sitting across the table from someone in a room or across the screen from them, this brings it all into life and brings it all into 3D, right? It creates a view of that member voice. So it allows us to just have a much more deep understanding of what that member is actually saying and not make lots of assumptions on their initial response. This also, allows us to target and to dive deep into specific topics that are pain points for our members with our specific organization. That might be, member retention for many of you. That might be just experience in general or responses to the CAHPS survey, being subpar, or lots of complaints. Whatever that is, this vehicle allows us to drill into that and develop a much deeper understanding across the enterprise of what those pain points are. Next slide. I want to touch on, when we think about what all goes into an enrollee advisory committee, even if you're a single state plan, you need to have multiple meetings. There's a lot that goes into the planning and the execution throughout the year. This is our take on what good looks like at a minimum, right? So this is not an exhaustive list. This is a partial list of elements that we think is necessary to have an impactful enrollee advisory committee experience for your organization, right? So, everything from the top left, critically important to initially develop a program strategy and scope, right? To bring the cross-functional leaders that are the market leaders, the sales leaders, the ops people, the medical management people, the STARS people, bring them all together and to have an actual strategy and scoping session where you're looking at every meeting next year, every market next year, and mapping out what are our pain points, what are our members' pain points, and what do the topics need to be, and how do we need this to look to be good. And then a really important part is identifying participants who are representative of your population, right? That's a requirement. That's one of the things that is spelled out clearly in the rules. Not necessarily what does that look like? What does representative mean? There are some examples, but that's a really important part, is to make sure you're, and I think Shub will get into more detail and into what does our solution look like as far as using deep analytics to really understand, condition-based, disability-based, race and ethnicity-based, rural versus urban, so many different factors to take into account to make sure we're including the right people for this vulnerable, underrepresented population or underserved population, right? To make sure we're hearing their voice and addressing their needs. And then recruiting and engaging these people, making sure they show up, managing the meetings, having virtual and in-person meetings, or maybe a hybrid meeting, in between where we have a virtual meeting, but we have rural members engaged who maybe don't have strong Wi-Fi. So we transport them to a local community center with several other members where they attend the virtual meeting from that community center. They're all in person, but they're connecting with everyone else in the committee virtually. Just different ways to get creative and innovative and to make sure that we're removing barriers for these people to show up, which is another thing that CMS is stressing that has to happen, right? We have to make sure anyone can come if they're disabled, if they don't have Wi-Fi or broadband. We have to make sure that they are able to attend and make their voices heard in these meetings. And then data collection and documentation. So from a program audit standpoint, making sure that you are ready, that you have everything documented. How many meetings did you have? How many people did you invite? How many showed up? What were the topics? What was the follow-up? What did you do with the insights that came from the meeting? Managing the meeting agenda, strategy across markets, across quarters, or however frequently you're having these meetings. Meeting attendance management, analysis, and insights, really, really important, right? So what are we learning from these meetings, and what are we doing with that? So, I mean, that's a huge focus for our solution, is to take those insights and actually use them to do two things. The last two boxes there on the bottom. Number one, to improve these events going forward. So every event learns from the last one and gets better and better and better. And in the very last box, improvement plan. So we take the insights from these members, from the things they are telling us, and we use it to actually build an action plan and improve our organization, whatever those pain points may be, to improve retention, to improve the experience, to improve CAP scores, to improve complaints, et cetera. And you can understand that's a lot, right? So all of that, what does that look like from a staffing standpoint? So if you do this internally, we think, and we have analysis to back this up, 5,000 hours per state, which is about 2.5 FTEs plus the meeting expenses of the facility or the technology, the snacks, right? The incentives, whatever those expenses look like. It's a lot. It's a huge lift. And then lastly, on the last slide for me, I just want to, because CMS is not being overly prescriptive here, plans are going to make a decision, right? So all of you are making a decision in 2023, either pretty much one of two things, right? You're either going to just meet the requirements, meet the guidelines, or you're going to take advantage of the opportunity. And you can do this internally, or you can, engage someone like us. But I think it's really, really important to convince your organization, and for you to be the voice as the DSNP leadership team, the DSNP product owners, or whatever your role might be from the DSNP standpoint, to make your voice heard internally and to ensure that your organization doesn't just meet the guidelines here, because you can, but you will be behind, because other organizations, we know, because we're working with several of them now, they are taking advantage of this opportunity to make these impactful, to have a well thought out strategy across all markets that addresses all their pain points, that really manages the meetings, manages the attendees, makes sure they show up, and most importantly, takes those insights and does something with them. So executes that enterprise-wide action plan to improve the experience, to improve retention, to improve, again, stars, or whatever the case might be. And with that, I'm going to turn it over to Shub.
Great, thank you, Rex. I'm Shub, I'm with Predict Health, and I wanted to actually take this deeper. So we've talked about being impactful, which is where we see a large number of organizations going. This is your opportunity in the DSNP world to capture, understand member issues and interact with them in a way that has never been done before and at scale. You will have to create these EACs in every state that you operate in. It's an opportunity, or every market you operate in. You can go deep into specific issues, understanding what the issues are and what's the color behind the issue, because healthcare, as you know, is local, and challenges happen at the local level, be it care coordination, be it why aren't your new benefits being utilized? Why is the retention so high? So this is an opportunity to have that conversation and to understand and dig deep. And so we see organizations who are looking to use EACs as this new channel of data and member voice. How do you collect that more effectively and be impactful? This is a heavy lift, as we saw on the previous page. Rex mentioned lots of time involved, and there are lots of stakeholders involved as well. And to get a meeting in EAC, whether it's a few hundred hours of somebody doing it on the side of the desk, but or also if you really want to make it impactful, getting buy-in from the organization, you really want to be able to allocate your time and your organization's time effectively. So we've adopted a process. It's an effective process that helps you achieve an impactful EAC. This has been honed over many years at some of the largest organizations, consulting organizations in the country, proven to deliver an outcome across a cross-functional and a complex enterprise, which we all are part of. So some of this may be familiar to you, but I want to stress on what the different steps are. So reading from the right, from the left to the right. It starts with scoping. So you really want to get buy-in and get the right stakeholders up front, because you cannot be force-fitting results if people haven't bought in or you aren't delivering what your original objectives were. It's really understanding what everybody cares about. Be it, and here we'll have multiple stakeholders will be touching or will be potentially impacted by EAC insight and meetings, be it STARS, be it the retention team, be it quality more generally, the compliance team, obviously, as well as program design and acquisition, member retention, and member experience teams. So multiple aspects of the organization, multiple functions are affected. You want them in the room at the earliest at the get-go to really share what are their priorities for which markets and which sets of population within your DSNP book. So scoping and strategy, this is an essential part to get going. Once you determine what your priority of your objectives are, what are you trying to achieve with this with these meetings across the next year or the next few years, you then need to design and build a specific program. Decisions around the number of meetings you want to have, decisions around whether it's virtual or in-person or even hybrid. If you're focusing on specific outcomes like retention, for example, you want to be able to attract the right people or invite the right people to give you a mix of where you're seeing retention risk or where you observe if you're entering a new market and you're looking at benefits, invite the right people into that meeting. So how you design and build a program matters and needs to tie back to your scoping and strategy as well as your corporate objectives. Then it is the actual operations. This is, a lot of you may have your existing advisory board or a local meeting. How do you adapt that for the EAC scale and EAC setting? So if it's virtual, how are you enabling a repeatable, consistent experience around a virtual meeting that sits across states or across your markets? If it's in-person only, how are you setting that experience up? How are you making it consistent with your virtual meetings so there's not a disconnect for who comes and how are the questions and data collected? And if it's hybrid, which many of you are seeing as an option, how do you manage that and operate those in an effective way under ADA compliance? Make sure that the right members come in and everyone has a voice, operate that effectively, and have members come back repeatedly. You don't want a one and done because that creates a lot of pressure on the organization and for staffing these meetings. Once you operate, then if you have multiple markets or multiple meetings, how do you capture the results and report that back to the internal stakeholders as well as for compliance purposes for CMS? Capturing results consistently and reporting it back consistently and in an apples to apples comparison across meetings is actually really hard. Organizations have had single programs, maybe a EAC-like meeting for the MMP program or your LTSS program. Those tended to be single state or relatively smaller scale. We have national organizations that have multiple states, looking across multiple markets, looking across multiple agenda items and objectives. How do you report back to your leadership, your stakeholders, so you can make objective decisions across markets and across plans? That consistency is a challenge. There are technology solutions, and we've there are platforms that can be used to allow you to make those smarter business decisions as you have. First, understanding the data and then reporting back. So results and reporting is really important and absolutely critical. It needs to be thought through from the get-go. So it ties to your objectives, what you're trying to achieve, and what the organization stakeholders are looking to achieve. And then finally, taking those results, once you report on them, how do you convert that into actions and outcomes? Not all problems could be solved immediately. How do you prioritize which ones are most urgent for your organization, for your members, and your objectives? How do you convert that into an action plan, be it for STARS improvement? As all of you know, member experience is a very critical aspect of STARS in 2023 and onwards. And how do you improve, say, report back on the factors that impact member experience back to the STARS team in a way that's actionable for them? How do you convert what you're hearing across not one meeting, across many meetings, across many markets back to the organization, and so you can then set up action items and outcomes. So there's a consistent step or a process that you need to put in place that starts really from today. If those of you have already started planning for your EACs, setting up your scoping meetings and so on and so forth. What's also critical is as to build in a feedback loop that goes in from once you're operating your meeting, the results you're capturing and reporting back on, and then the action items. How do you close that loop back within your organization? So they see changes, so you get the results, you get the action items, and you can drill down deeper. Remember, this is an interactive meeting. Often organizations are having multiple meetings a year, once a quarter. So you can actually go back to the same group and say, hey, we put this intervention in place. What do you see? And get that feedback. That tightens the loop. It helps the organization. It also helps members and the member engagement. So they see their voice being heard. They see the actions the plan is taking, and that builds their commitment back into the EACs and their commitment to the organization. So closing the loop back for the attendees or the enrollees themselves in the advisory committee is essential. So having that closed loop and then feeding off itself, it becomes a virtuous cycle, improves the meetings itself, the efficiency of how you are delivering the meeting, and then the outcomes for the organization. So regardless of where you are in your process or how you want to approach the meetings, we suggest putting a very systematic, consistent, multi-stakeholder input, capture multi-stakeholder input, and use a process to really implement and deliver a consistent experience for the members and the organizations to achieve their outcomes. The next, so once you do put a process in place, you will see that, and we see organizations looking to not just check the box, but there's so many things that you could do as a result of having these EACs. It's a big effort, 5,000 hours, 2.5 FTEs per market, per state is a big investment by an organization. So are you achieving the right outcomes? And here is just a short list of some of the outcomes we found that our clients are looking at using EACs and DSNPs. Access to care services, use of benefits. You have and benefits design, care coordination of care and care and coordination of services across the population, driving member experience. And this is a stated objective around improving health equity, understanding some of the challenges, and improving health equity for the vulnerable and underserved and underreached populations, improving plan member retention in your DSNP plans, achieving growth, which is tends to be a common objective, and ultimately tying it all together, improving STARS. The EACs is your opportunity to be able to influence a hard-to-reach population, a hard-to-engage population, and you now have a mandate to do so. So organizations who can do so and are doing so with a larger objective in mind have these in their sights. And what I'll spend the next few slides in the next few slides, I'll discuss taking one of these outcomes and describing how you can actually adapt your EACs to achieve a meaningful impact, and we'll talk about retention. Retention is a really big challenge in the DSNP world, and all of you have seen this. We see voluntary disenrollment at 20 to 40% for a plan. This is an enormous outlier if you look at all the other plans. Furthermore, in these steps, you have a quarterly possibility to switch plans. So you're really looking at a very short window and a fast cycle option to engage people, understand what their issues are, and then address them if you want to have an impact on retention. Now you do. So you can look at your numbers, you can look at where your markets are, which plans, which populations tend to have a higher disenrollment, and you use the EACs to address that effort. Furthermore, so far we've been trying to do it with benefit differentiation, lots of new offerings. There tends to be a large number of new offerings every year. We're coming to open enrollment, so we see that happening. But benefits utilization and differentiation tends to be poor. There's a lot of catch up. There's somebody offers a new benefit today, next year everybody else is offering in the market. And despite the effort, despite the benefits that we put in place, utilization tends to be low. We see single-digit utilization in many benefits, even some ones that you thought would be highly attractive for populations. Why the mismatch? Why the disconnect? Why did our research up front in the benefit design world give us data it's one way and didn't pan out in the marketplace? What are we missing? There's an opportunity to really understand that. Retention, regardless of the business impact, is also a STARS impact. It's a four-weighted STARS measure. And as of 2023, this year, it may go up, but it's a substantial effort. It's a substantial measure and has a big impact on your ratings and the potential dollars that come with it. And understanding and engaging this population has been a perennial problem for plans. This is your opportunity to really understand. You can test your communications. You can understand what's working, what's not. The world is changing. Technology adoption is changing. Channels that people are using and more effectively and in much more focused and targeted way is changing. How do you adapt? How do you learn and adapt? All these typical challenges really are common across plans, but they also have created a humongous problem around retention for organizations in the DSNP world. What we see is the opportunity to use the EACs to have an impact here. And the way to do that is really by understanding the members better. And you have the opportunity to do so with data. You can this is the problem we start with is we don't understand members. So before you even get to the EACs, there's an opportunity to use the information you already have. Predict Health, my organization, my team, we've painstakingly spent years and years to build that view of every member, of every senior in the country. Really build stitch together the rich understanding of what is known commercially, publicly, and then tie that with what is known internally within your organizations. So we work with our clients to be able to very quickly bring what we've collected and know about specific member you may have, about their social terms of health data, about their selection behaviors. Why did they choose a plan or not? Their switch triggers. Why are they likely to switch? What are their plan design fit? So what aspects of the plan design resonate with them the most? We built personas of these individuals. We were able to identify what aspects of the person are you most likely to, which types of individual are you most likely to attract to your plans and keep in your plans. All those insights are used and mined and analyzed to help you get a much better understanding of your population even before you start inviting people for your EACs. And by doing so, depending on your outcome you're trying to achieve, we can help you put the right group together, engage them smartly, early, and keep them engaged in the EACs. So, for example, we're talking about retention. You want to invite the people who will give you the biggest risk of retention for your plans. We're able to identify, based on our data, people who are likely, or members who are likely to, who have the highest risk of retention or leaving your plan in 90 days, the next 90 days, in the next 180 days, in the next year. So inviting those people early into your meeting, they just joined, they tend to be a quick disenrollee or a quick voluntary disenrollee. ask them, invite them, and understand what are their triggers. What is the issues? Is it cost? Is it another benefit? Is it change in circumstance? There are ways that our data will identify what are the likely reasons, validate those, and allow you to then develop interventions, programs to start affecting it. Understanding is step one, and data will help you get there. It also fast cycles the typical recruiting process for EACs and other markets, which tend to be survey driven. You need to send out a survey, depending on who responds, you need to then invite them for a meeting. That's a multi-step process and whittles down your pool very quickly. For example, there was a call that we were on where we heard for the MMPs, an LTSS program, they were inviting 3,000 people, engaged 3,000 people to get a 25 person meeting invite. Here you can fast cycle it. You have the data, we have the data, we can help you identify that group and pull them together very quickly. Use data to identify which members to invite for your objectives. And by using the data, you can also make sure that the people, if your objective is retention, they're also representative of your population, because that is meeting CMS's objective. So you can do both with this insight. Getting the right people in, and then focusing on areas where you have the highest risk. So our data shows, and this is data for Medicare Advantage in general, and this could be run for your plan and population, is where in their experience do you trip up the most, or members trip up the most? Is it pre-enrollment? Here, looking across Medicare Advantage plans, even before they start using a plan, you have 55% risk, or more than half the risk of a retention happens in the experiences that they have before they even start the plan. So sourcing, the onboarding process, the enrollment process, how they come on is absolutely critical. Understanding where you're falling down and what the challenges are allows you to zero in and develop that agenda that you want to engage in the EAC. And with those members, specifically around, it could be onboarding, for example. What are the material? What's the onboarding experience you have? Can we map that out? There are a number of studies now and workshops that are coming online. McKinsey's done a study. We've done a lot of work on onboarding specifically. How do you onboard smartly, and how do you tailor that for your population? And that's a big area here. And EACs allow you to do that. And then using the plan, where is it accessing care? We see this to be a big failure point. So having specific meetings or having that on the agenda for individuals who are likely to have this issue gives you that much more insight as you engage individuals and make this more meaningful. So not only just invite the right people, have the right agenda topics around the pain points that you're facing, that's proven to have an impact on your problems, and also the pain points that the members are facing. And that allows you to really start developing or outlining and building towards a much more meaningful and impactful EAC. So here is your cheat sheet that we put together for if you have to develop an impactful EACs. We would recommend setting the EAC program scope with the right objectives. So making sure that you set the right program goals, because you cannot have multiple goals. Make sure everybody's rowing in the same direction. Use analytics and predictive analytics and data on the members and the membership to really find and invite the right group of people to the meetings. If there's a mismatch between the group, the agenda topic, and the group you invited, you won't get very meaningful insights. And that's traditionally been a problem with advisory committees, where you have a group and they may not be facing that burning issue that you care about, and so the insights that you're able to capture tends to be far less actionable or meaningful back for you. Once you invite the right group and you're able to engage them, you set the meeting agenda to identify challenges that the members are facing, learn what they're facing, identify challenges that you have in your experience, what's tripping up, because you may think it's working, but it's definitely, there may be a problem that you're not seeing. And it also is an opportunity to test ideas with the population. You have an interactive communication once a quarter, at least, as when it is a multi-hour meeting, you can engage individuals deeply on a question. So if you, for example, communications, you could have examples of communications, and you can get those communications out, get people's reactions. You can look at this like what it really is. It's a smart focus group. So really bring that intelligence back in. A critical aspect of that is when you do so, you want to capture the data and the insights for company learning. So you can't just lose that insight. You got to build on it, keep it in your repository, and grow it, because every meeting is adding your asset knowledge base about your population. And using the meetings to measure the intervention. So after you set the agenda, after you test ideas, you create your intervention. This is your pulse. The EAC is your pulse on the plan of the membership and the population, seeing what's working, or what are they hearing across their peers and their friends who are in the same plan. Using some of the members in the EAC may even sign up for an intervention if you're offering it. Measure the intervention impact appropriately, and allows you to then assess the program ROI. This is absolutely critical as you think about how you're measuring the impact for your organization. Compliance is absolutely essential, but going beyond compliance and making this impactful, what is that achievement in terms of ROI for the investment you're making? It allows you to start measuring it. So here's a simple checklist that you can use, 4 steps. To help you determine if this program that you are putting in place, all the effort that you're putting in place, all the money that you're spending, all the time that you're requesting from your members is paying off for your organization and your plan, and is it impactful? There's another reason, and if you do so, you can actually see the returns. Here's an example that Predict Health, where we installed and implemented a similar EAC-like meeting for a similar population, a Medicare, Medicaid program, and try to identify what were the issues. This was for re-enrollment and redetermination. So what were the issues that members were facing, or the challenges they were facing? The meeting allowed us to identify and prioritize the interventions, test ideas, and then we targeted members using predictive analytics to invite the right group into these meetings and be able to then implement the intervention. When we going through this process allowed us to come out that much more effective in the intervention. It really improved the quality of the intervention. You see the impact. In 3 months, you saw an 18% improvement in the redetermination re-enrollment rate. Pretty significant. And this is the power of when you're able to get that second, third, fourth follow-up question, that deeper insight into what the challenge is. It's like you keep asking why, allows you to then drill down to really what the root causes are and be able to create a much more effective intervention and program to solve your member problem. And in the EAC, the fact that you're meeting with somebody, this group of individuals on a regular basis allows you to also test your other innovations, or try to innovate differently than your clients and your competitors. Rex has mentioned our STARS benchmarking survey. So this is a benchmarking survey for STARS leaders of what's working and what high-performing STARS organizations and functions do differently than the rest. And what we identified, and this is pretty critical part of that culture, is high-performing STARS organizations innovate and test and experiment more frequently. And part of doing so, they may have programs. There are a number of them, those listed here on the left-hand side, but they tend to innovate 2 or 3 programs a year. Not a lot. It's a moderate innovation, but they do it consistently. And EACs allow you, the fact that you're meeting with your members on the ground, people that they are seeing these interventions, or they are seeing what the innovations are, they'll be able to provide that feedback back to you. And they could be used as part of this building this innovation culture that organizations have, as well as, and it pays off for high-performing STARS for your programs. With that, let me turn it over to you, Jeff.
Yeah, wonderful. Thank you, Shub. Thank you, everyone, for joining us this afternoon. I'm going to be bringing our conversation to a close. And what I'd like to try to accomplish is to summarize and bring everybody back to perhaps the key points of what all my colleagues spoke to you about over the last 45 minutes or so. So a few things to please keep in mind. As Rex mentioned earlier, the combination of Predict Health and our other colleagues that you met today on the phone, we are bringing a depth and breadth of understanding of this process, both the challenges and the opportunities that health plans are going to face and be able to capitalize on for these EAC programs. As mentioned earlier, this is a relatively significant lift, whether you're talking about designing strategy or determining how to enroll members or actually trying to glean insights out of the process. There's a lot of work to get done here. And what we want to make sure everyone on today's call understands is that the capacity of our companies and our combined effort can address each of these at any level of scale that you deem fit for your organization. I think the second point that's very important for everyone on the call to recognize is that we understand, as Shub mentioned earlier, we are going to be touching all of your members and all of your customers, and that is a vitally important thing, and that we take it quite seriously, and we understand that that opportunity, you only get a chance to do it once and do it well, and we recognize the importance of the experience for your members who are participating in each of these events, but then also the data that we're going to collect and how important it is to make sure that we strike when the iron is hot. And make sure that we collect as much vital information that can be used by your leaders and leadership teams to make good decisions about your business. And then lastly, I think what's been webbed through really the entire conversation today is that we bring a high level of discipline around process, but we also have a significant set of analytical tools that you could only really see through the presentation, the outputs that we believe bring an enhanced level of quality and efficiency and accuracy to the analytics that we ultimately will provide to the leadership teams that engage with our firm. So it's just very important to kind of take a step back and say, lots to do here, but the combination of our businesses bring a lot of experience, both on the delivery side, but then also on the analytics side. Would you advance the slide, please? And so with that, it's also very important to make sure that what we deliver is tailored to your needs. As both Rex and Shub mentioned before, we take a very standard approach that you would see through really any well-known consulting organization. Shub walked you all through kind of our 5 steps, starting with scoping and strategy, and then ultimately delivery and providing insights. That is combined, I believe, with a pretty collaborative nature of our team, our delivery people, and building that rapport, not only with your members, as we will be helping with executing on all of these plans, but also with your leadership teams. We also recognize that one shoe does not fit all feet. And we did not want anyone to really walk away from this conversation saying, wow, do we have to take on all of this? We've also been quite thoughtful and also understand that there may be areas that you've already begun to work on. There may be areas that you already are quite proficient in. And so we've also tried to tailor our approach so that it can almost be not so much, as we mentioned here, like ad hoc, but really kind of your ability to pick and choose things that are most important to you, where we can bring the most value in helping you execute your plans for ultimate success, and then really most importantly for sustainability over time. So the big takeaway, that I want everyone on the webinar to remember here is very disciplined approach, proven approach, but then we also tailor each of our deliveries to what our clients need and what they find as the highest priority. Would you advance the slide, please, Shrub? So in conclusion, the big point for me is, why would you choose to work with us? And I think kind of starting at the top left, industry experience, folks with deep professional services experience, industry experience with both Medicare, Medicaid, and commercial insurance plans. We've developed a proven approach through a combination of each of our firms. We have a large toolkit of proprietary technology and data sets, as Shub mentioned earlier, that will provide very meaningful, high quality insights for decision making. And then ultimately, we believe a very cost-effective approach that can be, for our clients, be measured very clearly on a return on investments basis. So if you could advance the slide one more. On behalf of my colleagues, Rex and Michael and Casey and Shub, we'd like to remind you once again, all this kicks off in a few months. We are very interested in speaking to you about your needs. I can be reached at the number there on the bottom left of your screen, or my colleague Rex can also be reached as well. Please feel free to engage with either one of us if you have questions, comments, or require some additional information. And with that, I'd like to kind of conclude our formal remarks, hand the microphone back over to Shub, and hopefully we can open the line to some of the chat questions that we have from our participants. And thank you very much for joining us. Shub?
Thanks. Rex, do we have a question?
We do have just a few, but so the first one just says, this is so helpful. Will this deck be provided to the viewers after this discussion?
Yes, so we will provide, Johnson question. Yes, absolutely. We'll be providing a link as well as a section of the deck. Plus, definitely, how do you get in touch with us? We can answer additional questions for sure.
And then the second one is around timing. How long does it take to stand this up?
Yeah, great. So I guess, Shub, I'll take a swing at that. So that's a big question. But once we get through the logistics of contracting, and programs can be stood up in a matter of several weeks. As we mentioned, we have a preset methodology and framework that we follow. We have all of our materials that can be tailored to each of our clients' needs. So to say that we work with urgency, I think would be a fair statement. And we certainly would welcome discussing any timelines that anyone on the call may have. And I'm pretty confident we could fit into those constraints, or we would do our absolute best to fit into those constraints. So we're a pretty piffy group.
And the last one we have so far, and if anyone else has a question, please throw it in the Q&A or the chat. We have a few minutes left. It's just around the difference between, basically, can we leverage the LTSS program requirements for these the EACs? So can we take the LTSS requirements and leverage those for the EAC plans?
Yes, so the LTSS requirements that CMS has put together are similar, but they're not identical. Because for one, there would be the EAC requirements is federal, and you would have to adapt that to local state additional constraints if need be. So on the requirement side, you need to be able to really flush through those. There are differences around how you recruit, how representative the population is that you invite to an EAC, be it for your market or your plan. So you'll have to make sure that those boxes are checked. And then the agenda items that you use, you have a little bit more flexibility depending on state level requirements, but you have a little bit more flexibility on your agenda for the EAC. In terms of making them impactful, EAC meetings for DSNPs tend to be a lot more flexible. How you use the critical criteria here is bringing member voice or member input into plan governance. So you need to really be able to demonstrate that the meeting, the member voice that you capture, the member input is being used for plan governance. That's on the CMS requirement. But taking that further is how do you actually see the impact in your plan outcomes, and certain steps that are not the requirements, but this is what if you folks who are looking for an impact for the EAC are doing. Jeff, Rex, anything else to add then?
The only thing that I would add is any type of current experience is always going to be very beneficial to developing any kind of new program. So to Shub's point, a lot of those prior learnings and prior processes could help benefit whatever we design in the future. So that's always a benefit for us.
Yeah, and I would also just add that while CMS has said that nothing in the federal rule prohibits you from using the MLTSS committee, the committee that you've set up to inform the MLTSS plan as your DSNP, the CMS did say that a state could prohibit that through their contract or in either the managed care side, the Medicaid side, or the DSNP side. So you would have to just make sure that that's permitted by the terms of the state contract.
Great point.
And that's all the questions that we have so far.
Wonderful. Thank you.
So with that, Rex, Casey, Jeff, and Mike, we'd like to thank you very much for joining us today, and look forward to continuing the conversation. If you have questions that come up, this is a journey that we're starting all together, and there's so much learning that organizations are having, and we'd be happy to share them back and adapt them to meet your needs. Thank you very much.
Thank you, everyone.
Thanks, everyone.